Good day, Doc. For this video presentation, we will discuss a case study about homonymous hemianopia. It is a condition in which a person sees only one side, either the right or left, of the visual world of each eye. For the case study, a 34-year-old male complained a sudden left-sided visual field loss and an occipital headache and was referred for evaluation. During the interview, he mentioned that he is experiencing depression and has borderline hypertension, asthma, and migraine headaches. He is an active smoker for 20 years. He also reported having a stroke 4 years earlier, but no MRI or other work-up had been done to confirm about the event. After the stroke, his symptoms was left-sided weakness, short-term memory problems, and a stutter. But he stated that these symptoms had been resolved after rehabilitation therapy. Due to his health condition, his current medications included an albuterol inhaler, clonazepam, and nortriptyline. Upon presentation at TER, peripheral pulse rate was measured to be 80 beats per minute, respiratory rate was 16 cycles per minute, and blood pressure was 114/85. The patient reported with no neurological deficits. Extraocular motilities were full with no restrictions. He was examined with CT scan, complete blood count with differential and a basic metabolic panel, and the results were unremarkable or no abnormal findings. During eye examination, uncorrected distance visual acuities were 20/100 with pinhole 20/40 in the right eye and 20/200 with pinhole 20/30 in the left eye. Uncorrected near visual acuities were 20/20 in both the right and left eyes. Cover testing at distance and near revealed orthophoric ocular alignment. Stroke laboratory screen were completed and no abnormalities were found. He was also examined with an ECG and transesophageal echocardiogram, and the result shows no evidence of intracardiac mass or thrombus. The ventricular chamber size and heart valves were normal. The computed tomography angiography was negative for any significant vascular abnormalities in the neck. No definite etiology of the stroke was established, but the mechanism was thought to be cardioembolic.
Confirmation. Humphrey Central 24-2 threshold visual field test confirmed a complete left homonymous Hemianopia. The Humphrey visual field test measured the entire area of the peripheral vision that can be seen while the eye is focused on a central point. During this test, lights of varying intensities appear in different parts of the visual field while the patient eye is focused in a certain spot. MRI revealed recent infarcts predominantly involving the right occipital lobe with smaller infarcts in the right thalamus and left occipital lobe. The visual field test is a subjective measure of a central and peripheral vision or side vision and is used by the doctor to diagnose or determine the severity of and monitor your glaucoma. The most common visual field test uses a light spot that is repeatedly presented in different areas of your peripheral vision.
For the treatment, optical aids are the most commonly used treatment modality for patients with homonymous hemianopia. One form of optical aid is the hemianopic spectacle, or a kind of spectacles incorporating a device that provides a lateral displacement of one or both fields of view. These glasses involve fitting a small mirror onto the spectacle frame that can be adjusted to allow the patient to see the reflection of objects in the blind field. Next is a surgical revascularization. It's controversial and is based upon the idea that after a stroke there is an area of non-functioning but viable tissue that could recover function if blood flow is restored. There are case reports of neurological defects reversing after surgical revascularization, but there are no current guidelines to identify patients with neurologic deficits and viable tissue that could benefit from revascularization. In addition, the bypass are associated with excess mortality.
The treatment and management for the homonymous hemianopia are prisms and cognitive rehabilitation techniques. For the prism lens aims to expand your peripheral visual field if you have a homonymous hemianopia. It works by using high-powered prisms to shift the image from this side with visual field loss onto the other side where you can see it. Next is cognitive rehabilitation techniques. Health professional that objective recovery from visual field loss is impossible. So they will be using the cognitive rehabilitation techniques. Thank you.